I'm going to be the nurse assessing you today. What's your name?
Pat.
And what's bringing you in to see me today?
My annual physical.
Okay, well, what we're going to do today is I'm just going to take a look at you from pretty much top to bottom. First thing I'm going to do is I'm going to take a look at your scalp. I see you're running your hands through your hair already. Any problems with your scalp? Any lesions you've noted? Any problems?
Nope.
Your hair is nice and glossy. Your head is equal. Your normal cephalic is what they call that. I'm going to take a look at your face, look at the symmetry. I'm going to be testing cranial nerve 7. So I'm going to ask you to do a few things. Go ahead and smile for me. Frown. Now I want you to take your eyes and squint them as hard as you can, and don't let me open your eyes. Okay? Go ahead and lift your eyebrows together. All right? Show me your teeth. And then puff out your cheeks. All right. Now I'm going to go ahead and palpate your temporal artery. Is there any pain that you're having in here?
No.
Go ahead and open and close your mouth. Do it one more time. Any pain?
No.
I'm going to press your maxillary sinus. Any pain when I do this?
No.
Any pain when I do your frontal sinus?
No.
Okay. If you did have pain, then we would check for transillumination. But that test could be skewed because of a chronic sinusitis. All right. Now I'm going to do an eye exam. And what I'm going to have you do is I'm going to have you cover one of your eyes with this card. I'm going to cover my eye, and I'm going to have you look straight at me. All right? And what I want you to do, which I did that. What I want you to do is look straight at me and tell me when you see my fingers come into view.
There. There.
Okay, next eye. I'll switch cards. Okay. And again, look straight at me. Tell me when my fingers come into view.
There. There.
Okay. Next thing we're going to do is we're going to do, sorry, we're going to look at your corneal light reflex. Take a look straight at me. And the light reflex is in the same position in both eyes. We're going to do your 6 cardinal fields of gaze. We're testing cranial nerve 3, 4, and 6. And what I'm going to be looking for is smoothness and the movement of your eyes. So, take a look at my pen. Now follow my pen. Okay, nice and smooth and even. And we're gonna do a cover test. What I want you to do is take this card again, and when I tell you to, I'm gonna have you look straight at me the whole time, but I have you cover one of the eyes, okay? And don't take the card down until I tell you. So go ahead and cover one of your eyes, and then take it down. And then do the other eye, and then take it down. Okay? No weakness noted in the eyes. I'm going to look at your external eyes. Okay? I see no lid lag, no ptosis, and no edema. I'm going to take a look at the inside of your eyes here. In the conjunctiva, they're nice and pink and moist. The sclera is white and moist looking. The corneas look clear and smooth, and your irises are round and even in color. Okay, now the next thing we're going to do is I'm going to take a look at your pupil size. So I'm going to dim the light here for just a second. I'm going to shine a light in your eyes, and you look straight at me, okay? And this eye. Okay, equally reactive, 3 to 1. And then I'm going to have you take a look at my pen. All right? And what I want you to do is look at my pen here, and then I want you to look past me at the wall behind me. Look back at my pen. Okay, and equal reaction with the pupils on that as well. The next thing we're going to do is I'm going to have to do an abdominal assessment on you. So I'll have you take off your shirt and things and lie on the bed, and if you could just pause for me for just a minute. All right, now I'm just taking a look at your belly, looking at the contour, making sure I don't see any pulsations, that everything looks equal and symmetrical. The skin looks even. I see no lesions or scarring. The umbilicus, I'm not seeing any hernias in the umbilicus. I'm going to take a listen to your bowel sounds. Make sure that it's nice and active. I'm sorry, my hands are cold. And I'm going to take a listen in all 4 quadrants. The bowel sounds are reactive in all 4 quadrants. I'm going to go ahead and do some percussion. I'm going to just touch your belly here and take a listen to the sound I hear in your belly. Normally it's timpani, but over some organs it could be dull. I'm hearing timpani all the way through. Alright, make sure we don't have any splenic dullness. Don't hear any there. And then I'm going to go ahead and palpate your abdomen just lightly at first. Make sure I don't have any masses and that the tone of your muscles are even. Alright, and then I'm going to go ahead and do some deep palpation. I'm not feeling any liver borders over here. No splenic borders. Okay, I'd be positioned better on the other side of the bed, but take a deep breath in. Go ahead and let it out. I don't feel any liver borders there. Okay, and next what I would do is go ahead and assess the femoral artery. The femoral arteries are on both sides, lower than the inguinal ligament, halfway between the pubis and the superior iliac spine. And then I would also feel around for your inguinal lymph nodes. The horizontal chain is along the groin, just below the inguinal ligament. And then the vertical chain is actually in the upper thigh. But I'm going to divert that right now. Next thing I need to do is do a musculoskeletal exam and make sure you have equal strength in all of your muscles. Go ahead and pause. Mr. Sweeney, what I'm going to have you do is I'm going to actually have you walk across the room so I can take a look at how you walk. So go ahead and walk all the way to that door and back, which is about 20 feet. And you have good steady gait. Come on back. Good steady gait and your arms swing appropriately. Stop. Now the next thing I'm going to have you do is take your heels to toe. Go ahead and touch heel to toe and walk across the room. Yep. And nice and steady. Good job. Go ahead and stop. And then I'm going to have you do tiptoe. Tiptoe a couple of steps and then go ahead and walk on your heels a couple of steps. Now on your heels. And it's a nice steady gait. Now what I want you to do is close your eyes and put your arms to your side. Put your head back just a little bit. Okay, negative for a Romberg test. You're able to hold your balance. Now the next thing I need you to do is do a shallow knee bend. So just take one leg and bend down. And then do the same thing with the other leg. Any pain when you do that?
No.
Okay, nice and even. Go ahead and lean down and touch your toes. And I'm just going to move around here. Keep down like that for me for just a second. And I'm looking to make sure he's got a nice C curvature on his spine. And he's able to go down to 90 degrees. Go ahead and stand up. Go ahead and lean back and hyperextend your back for me. Okay, good 30%. Now, straight there, and what I want you to do is go ahead and move side to side, like this. And then the other way. Good. Now I want you to twist back and forth like this. Okay, now the other way. Good range of motion. All right, that concludes our assessment. Thank you, and look to see you again next year.
Yay.